Hi everyone, my name is Dr. Vicino. I am a naturopathic doctor who specializes in neuropsychiatry, but I work with the entire body because it is never just one organ or one system that we're dealing with. Today I want to talk about brain fog because over the years, brain fog has been something that a lot of my patients have struggled with, and it comes from many different origins. So I want to kind of clarify what brain fog is, how we experience it, and where it comes from. So when we're talking about brain fog, there's 6 different foundations. The first one being sleep. Sleep is so important, whether we are on shift work, whether we're having poor sleep, whether we're not able to fall asleep, stay asleep. Sleeping for that 8-hour duration is really, really important for restoration, but also for making sure that our body is able to rejuvenate and have our brain function in the way that it's supposed to. So if you're dealing with brain fog, you need to make sure that you have a proper sleep schedule and that sleep is not a problem that is contributing. Number 2 is diet. Blood sugar swings are a huge problem when it comes to brain fog, which underlying is insulin resistance. The thing here is we can test blood work. So there's something called a HOMA-IR, which we're looking at fasting insulin and fasting glucose, that can show us kind of early stages, moderate or severe stages of insulin resistance. If we have underlying insulin resistance, it doesn't mean that we necessarily have type 2 diabetes yet. So if we're measuring that HbA1c, which is our normal blood sugar marker, it might not be indicating that anything is going on with glucose or insulin in the body yet, but there is something contributing to the overall symptoms that we're experiencing. 9 times out of 10, I have people who are not yet pre-diabetic who have severe insulin resistance, meaning if we continue in this direction, we are going to be dealing with type 2 diabetes very soon. And when you fix the insulin problem, it is a lot easier to manage and a lot of these symptoms can go away. Number 3 is high cortisol or high stress. If you are in a high stress environment and you are running on adrenaline and stress all the time, whether it is your job, whether it is the fact that you have children, this is a huge indicator for how the body is metabolizing cortisol and functioning. Cortisol for a long period of time in super high zones can lead to that brain fog experience. And then when we're able to kind of relax the body, support the adrenals, support the other stress systems, we're able to bring it down. Number 4 is probably the most common that people know for brain fog, but what I find fascinating is there's still a lot of people out there with hypothyroidism who don't have the right tools, who are still having uncontrolled hypothyroid with their medication. So if you are somebody with hypothyroid who has done the testing and your TSH is in good range and you're on levothyroxine, but yet you still have the brain fog, you still have the cold hands and feet, you still have issues with constipation, all of these symptoms are coming up because your thyroid is not functioning optimally. Just because you put thyroid medication into the body does not mean you fix your overall thyroid issue. There's multiple organs that are involved in thyroid hormone. There's the gut, there's the liver, and then your thyroid hormone synthesis itself, which interacts with chronic infections and inflammation. So you really need to look at the whole picture. Make sure that your thyroid is in an optimal range, which is actually 1 to 2 and not that big range from 0.4 to 6 to get you feeling good and to make sure that that brain fog is getting better. I have had cases where people who are kind of in that normal range for thyroid, I treat the thyroid and the brain fog goes away. So this is a huge component. Another one is mineral deficiencies, which I also think we're pretty good at treating at this point. Vitamin B12, iron deficiency, magnesium deficiency. You just do a simple mineral panel, see where your levels are, and then, fix the root cause. If you're not absorbing the iron, if you're not eating enough of the iron, figuring out where that deficiency comes from and treating it. The other one is adrenal burnout. So adrenal fatigue kind of goes with that HPA Axis dysfunction, which is part of the thyroid issue. If you fix the insulin resistance and you fix the stress component, then you're going to inadvertently fix the adrenal fatigue HPA Axis dysfunction. So figure out why your body is running on overdrive and go from there. The last one is gut health. So gut health, like I said, kind of plays into all of these. If you're not sleeping well, you might have gut issues. If you're not eating well, you might have gut issues. If you have chronic stress, you will have gut issues. If you have thyroid conditions, you're also going to have gut issues. So the gut is really important for inflammation, but also for our overall inflammatory response and immune support. So it makes our neurotransmitters, makes our immune system. A poor gut equals poor health, especially in the terms of leaky gut. So leaky gut syndrome is when that gut barrier is like this and it's supposed to be like this. It's supposed to be nice and tight. If it opens, all of a sudden these things that are supposed to be staying outside of the body, right? They're supposed to be going out. You're supposed to be getting rid of them. You're supposed to be eliminating them, are reabsorbing, going into the systemic circulation and causing neuroinflammation in the brain. So we want to make sure that that gut barrier is closed so that our gut is not causing a leaky brain. I often see this with people who love their coffee on an empty stomach. What you're doing when you're drinking coffee on an empty stomach is you're taking this barrier and you're going like this. It immediately causes a infraction or a inability for the gut to close. So you cause that leaky gut syndrome, which can lead to the systemic absorption and, again, the brain fog that people experience from neuroinflammation. So yeah, so this is my video on brain fog. If you guys like it, I would love to hear your comments. If you have questions, let me know in the comments. If you thought this was useful, let me know in the comments, say this was useful. Or if you have other things that you'd like me to do, just put it in the comments and I will work on getting those videos out to you. Don't forget to subscribe to our channel for lots of more information, and I will see you at the next video.